Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Leukemia. Pediatrics. Introduction. Leukemia is the name of a group of cancers of the blood cells. It is the most common type of childhood cancer in the world. There are different types of leukemia and several treatment options for each type. This program explains what leukemia is and reviews its causes, symptoms, diagnosis, and treatment options. Cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing without normal controls, causing an abnormal growth called a tumor. If a tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. If the tumor invades and destroys nearby cells, it is called a malignant tumor or cancer. Cancer can sometimes be life-threatening. Cancerous cells sometimes spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer treatments are used to kill or control abnormally growing cancerous cells. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the pancreas will always be called pancreatic cancer, even if it spreads to other places in the body. Although healthcare providers can locate where a cancer started, the cause of cancer in an individual patient cannot always be identified. Cells contain hereditary or genetic material called chromosomes. Chromosomes control the growth of cells. Cancer always arises from changes that happen in the chromosomes. When the chromosomes in a cell become abnormal, the cell can lose the ability to control its growth. Sudden changes in the genetic material can happen for a variety of reasons. These changes are sometimes inherited. Changes in chromosomes may also happen as a result of exposure to infections, drugs, tobacco, chemicals, or other factors. In the case of skin cancer, sunlight causes damage to the chromosomes leading to cancer. Leukemia. Leukemia is cancer of the blood cells. Normal blood is made of a fluid called plasma and three types of cells: white blood cells, red blood cells, platelets. White blood cells, also called WBCs or leukocytes, help the body fight infection and disease. Red blood cells, also called RBCs or erythrocytes, carry oxygen from the lungs to the body's tissues. They also take carbon dioxide from the tissues back to the lungs. The red blood cells give blood its red color. Platelets, also called thrombocytes, help blood to clot when a person is injured. By clotting, bleeding is controlled and the injured person does not lose excessive amounts of blood. Blood cells are formed in the soft, spongy center of bones, called the bone marrow. New, undeveloped blood cells are called blasts. Some blasts stay in the marrow to mature, while some travel to other parts of the body to mature. Normally, blood cells are produced in a controlled way as the body needs them. This process helps keep us healthy. When leukemia develops, the body produces large numbers of abnormal white blood cells. The leukemia cells usually look different from normal white blood cells and do not function properly. There are currently no known causes of leukemia, but researchers have found certain risk factors that increase a person's risk of getting leukemia. The following are leukemia risk factors. High-energy radiation, such as atomic radiation seen in survivors of the Hiroshima and Nagasaki bombs. Genetic conditions, such as Down syndrome. Long exposure to chemicals such as benzene. Other risk factors for leukemia include past treatment with radiation or chemotherapy, family history of leukemia, smoking. Leukemia is commonly labeled by how quickly it develops and gets worse. In acute leukemia, the disease gets worse quickly. In chronic leukemia, the disease gets worse gradually. Leukemia can also be labeled based on the type of white blood cells it affects. Lymphocytic leukemia and myelogenous leukemia are two such examples. The following table shows the most common types of leukemia. Click on a type to learn more about it. Lymphocytic leukemia, myeloid leukemia. Leukemias that affect children are almost always acute leukemias. Chronic leukemias tend to happen in adults and older people. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Leukemia cells are abnormal cells that cannot do what normal blood cells do. They cannot help the body fight infections. For this reason, people with leukemia often get infections and have fevers. Leukemia patients often do not have enough healthy red blood cells or enough platelets. As a result, the body does not receive enough oxygen. Without enough red blood cells, the patient has a condition called anemia. Anemia causes patients to look pale and feel weak and tired. Without enough platelets, patients bleed and bruise easily. Some of the common symptoms of leukemia include fever or chills, weakness and fatigue, frequent infections, weight loss, swollen or tender lymph nodes, easy bleeding or bruising. Other symptoms of leukemia include tiny red spots called petechia under the skin caused by abnormal bleeding, swollen or bleeding gums, sweating, especially at night, bone or joint pain. Like all blood cells, leukemia cells travel through the body. Depending on where these cells accumulate, patients with leukemia may have a number of symptoms. If leukemia cells collect in the brain or spinal cord, it may cause headaches, vomiting, confusion, loss of muscle control, seizures. If leukemia cells collect in the testicles may become swollen. Some patients develop sores in the eyes or on the skin. Leukemia can also affect the digestive tract, kidneys, lungs, or other parts of the body. Diagnosis. In order to diagnose leukemia, a healthcare provider takes a detailed medical history and does a thorough physical examination. Blood tests also help in diagnosing leukemia. A sample of blood is examined under a microscope to see what the cells look like and to determine the number of mature cells and blasts. Although blood tests may reveal leukemia, they may not show what type it is. To check further for leukemia cells or to tell what type of leukemia a patient has, a hematologist, oncologist, or pathologist examines a sample of bone marrow under a microscope. A bone marrow aspiration is one way to collect a bone marrow sample. The healthcare provider inserts a needle into a large bone, usually the hip, and removes a small amount of liquid bone marrow. A bone marrow biopsy is another way to collect a bone marrow sample. It is performed with a larger needle and removes a small piece of bone and bone marrow. If leukemia cells are found in a bone marrow sample, the healthcare provider orders more tests to find out the extent of the disease. A spinal tap checks for leukemia cells in the fluid around the brain and spinal cord. Chest X-rays can reveal signs of leukemia in the chest. Treatment. Treatment for leukemia is complex. It varies depending on the type of leukemia and is not the same for all patients. Leukemia treatment depends on the type of leukemia, the extent of the disease, whether the leukemia has been treated before, the patient's age, symptoms, and general health. Acute leukemia should be treated right away. The main goal of treatment is to stop the disease. This is also called remission. The other goal of leukemia treatment is to prevent it from happening again or relapsing. Many people with acute leukemia can be cured. Most patients with leukemia are treated with chemotherapy. Some also may have one or more of the following: radiation therapy, bone marrow transplantation or BMT, biological therapy, targeted therapy, surgery to remove the spleen called a splenectomy. Many patients with leukemia take part in clinical trials. Clinical trials are experiments designed to find out whether a new treatment is safe and effective. These treatments are usually thought to be at least as effective as the most effective treatment available. It is hard to limit the effects of therapy so that only leukemia cells are destroyed. Since treatment also damages healthy cells and tissues, it causes side effects. The side effects of cancer treatment vary depending on the type and extent of treatment. In addition, each patient reacts differently. Side effects may even be different from one treatment to the next. Healthcare providers try to plan the patient's therapy to keep side effects at a minimum. In addition to killing cancer cells, healthcare providers treat the symptoms and complications of leukemia. For example, infections are usually treated with antibiotics. Bleeding may be treated with a blood transfusion. Loss of appetite is treated with a good nutrition program. Patients with leukemia can also stay healthy by avoiding people with colds and other infectious diseases. Eating well. Following good dental care and hygiene before and after treatment. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Leukemia is the name of a group of cancers of the blood cells. It is the most common type of childhood cancer around the world. There are no known causes of leukemia, but researchers have found certain risk factors that increase a person's risk of getting leukemia. There are different types of leukemia and several treatment options for each type. Leukemias that affect children are almost always acute leukemias. In acute leukemia, the disease gets worse quickly. Most patients with leukemia are treated with chemotherapy. Some also may have one or more of the following: radiation therapy, bone marrow transplantation or BMT, biological therapy, targeted therapy, surgery to remove the spleen called a splenectomy. Thanks to recent medical advances, treatment of leukemia has improved dramatically in the past few decades. This has resulted in frequent cures and long-term survival. Thank you for using Explain.